people just need to know, first of all, that this topic completely blew up. We are probably going to end up doing 2 lives on this, only because, just for the record, we have 39 questions. An average live gets through anywhere between 6 to 9 questions. So just to give you an idea of just how many there were. And the questions are not like yes or no questions. They're all very intense, and they all really deserve answers. And I have to commend people. One of the things I was telling Dr. Koslowitz is I felt that people found a very safe space to ask these questions, and we're asking very honest and insightful questions. I think they were wonderful.
Yeah, we got amazing questions, and like a few more came into my DMs like in between the time we talked and now. But yeah, questions are pouring in, which is great.
Okay, so what I kind of did is I sort of like categorize them a little bit, so it'll just make it easier for us, especially if some of them we end up getting answered, then we'll lump them together. And we're going to try to get as many as we can tonight, and whatever else we'll have to follow up a different time. So Dr. K, do you want to start just in general? Let's talk about therapy in general before we even jump into the questions.
Sure. So one of the things I think that I want everybody to understand, the reason I started this whole topic and the reason I said, like, let's do an Ask Me Anything about therapy is that somebody called me considering asking for services for one of her kids. In the course of our conversation, she mentioned a therapy that she had been in. And this is somebody, happens to be, we're going to talk about this in a little bit, somebody I interacted with a little bit on LinkedIn. I know her by reputation. I don't know her well. An intelligent person, someone who, who understands the world, someone who, has, I'm sure, exposure to concepts about therapy and things like that. She was telling me a story about her therapy experience. And in the story, there were certain things that were egregiously wrong that she was telling me about how her therapy had been set up. And when I pointed those things out to her, she knew one of the things was wrong. She said, like, right away, I was very uncomfortable with that. But she wasn't aware of certain basic assumptions about therapy, how therapy works, what the therapeutic relationship is and what it isn't. For example, why we have the concept of confidentiality. What's the purpose of it? Like, there were certain things that even though she's a very intelligent person, very capable person, she just didn't know. And it made me realize that there are certain assumptions that therapists have. Like therapy is a culture, just like any culture is a culture, right? Like Borough Park's a culture, Muncie's a culture, Lakewood's a culture. They're all cultures. Lakewood has 5 different cultures now, but like we're all cultures. Therapy is a culture, right? And there's certain cultural assumptions that we make about therapy that, perhaps people are not as aware of. I think because we have a lot of surface knowledge about a lot of therapy concepts, but I want people to understand about the therapeutic relationship, what it is and what it isn't and how it works, so you understand the foundational stuff that people don't always know. I happen to be very passionate about this stuff. I sit on my state ethics committee. I read about this stuff all the time. I think hard about the therapeutic relationship a lot. So there are even therapists who don't think about this or get enough training in this. So I want everyone to understand that. The first thing I think that I want everybody to know is that therapy is a fiduciary relationship. A fiduciary relationship means therapy is a relationship that you pay for. Now, here's my belief about fiduciary relationships. I firmly believe, and this is going to be a little controversial, that the only true relationship that is completely for your benefit is a fiduciary one. Because what a fiduciary relationship means is, in all human relationships, there's give and take. Right? If you're friends and you are schmoozing with your friend, then there's give and take. You vent, your friend vents, right? You pick up your kids from the bus stop, you need anything from the grocery store, right? Give and take. We each give, we each take. We hope they'll be somewhat reciprocal. We'll each give and each take the most with each other. Here and there it doesn't work out that way, then we end up in therapy sometimes, right? But that's what a regular relationship is. A fiduciary relationship means the give that the patient gives is money. The take that the therapist gets is money, right? And that's it, right? That's the point. In other words, you know the price. The price is whatever the therapist charges. With your friend, you don't always know the price, right? And there are some people that you don't want them to do you a favor, for example, because you know good and well that the price of that favor is going to be too high. Or like sometimes I get phone calls from people, can I offer you this free service? And I always say, like, free services cost more than I can afford, right? Like, I don't know what the cost is, right? It's true. It's a fact of life, right? A free service. Now, sometimes someone tells me straight out, somebody called me and said, can I offer you, I want to design a logo for you for free because people know you're out there in the world, and then my work will get known. Okay, I know the give, I know the take, right? She'll give me a logo for free. I will recommend her, right? The question would, of course, be, what if I hate her logo, right? That would be my first question. Like, what happens if I don't recommend you, right? But okay, fine. But the idea being, of course, that's me talking as someone who thinks like a member of the ethics committee, right? Like, what's the worst case scenario here? But that's what a fiduciary relationship is. And as part of a fiduciary relationship, all the other rights and all the things you've heard about in therapy, like confidentiality, like boundaries, right? All of those things come from the fact that therapy is a fiduciary relationship. And so everybody needs to understand that. And what I mean by that is, when you come into therapy, who owns your information, right? Who owns the goal, right? You might have one goal and your mother might have a different goal. Whose goal is the goal that matters, right? All of those things are why we lay out the roles, responsibilities, and we understand these things, because therapy is meant to be a fiduciary relationship. When therapy is something else for the therapist, that's when the therapist is doing something wrong, right? That's a problem. And that's why therapists should be, this is my belief, it's not a rule, it's not a law, but it's kind of an unwritten expectation. All therapists should be in their own therapy. First of all, conceptually speaking, how can you lead someone down a path you haven't gone down yourself? That just, to me, like, just hello, that's just obvious. Number one. Number two, the minute you're not in therapy as a therapist, the minute you're not doing supervision, is the minute that your therapy relationships with your patients might become about something that isn't fiduciary. Your self-esteem as a good therapist, your enjoyment of spending time with this person, your need to fix something that you went through, right? And all of those might be true, but if you're in therapy with a therapist who's helping you keep that in check, then therapy stays fiduciary. That's why, again, the first question when someone asks me, is someone a good therapist, is if you want to know, is she in her own therapy? Does she go for supervision? Right? Then, okay, that's a very good first step, first question to ask. So let's head into some of the questions, but let's just keep remembering, I'm going to keep referring back to this concept of fiduciary over and over and over and over again. But so what's our first question?
Okay, I want to jump into the questions. I also want to add one thing that's sort of tangential to what you said. One of the things that I tell the teens that I work with is a lot of times they get stuck on the fact that the therapy relationship is like a teacher relationship, right? That's their only concept that they have of another adult in their lives. And children very much see therapists in the same light sometimes, right, as educators. And what I often tell the parents, who also sometimes have only the relationship of like, this is my child's teacher, right? Or versus stuff like that. What I like to say is, and not all therapists like me for this, I said therapy is more like plumbing. And when I say that, it's when you hire a plumber to come to your house and you say, plumber, let me show you, I have a leak under my fleischica sink. He goes to look and he says, we got to fix the bathtub. If you have any brains in your head, you're going to look at the plumber and say, unless you can give me a good reason why you've got to undo the tiles in my bathroom and dig under that tub, we're fixing the kitchen sink. Now, sometimes the plumber gives you a very good explanation. He says, look, the pipe that's leaking under the sink is really connected to the tub. And if we don't fix that main valve, we can put Band-Aids. It will break every 6 weeks, right? So there's that explanation in there. And I like to say that is that, like you said, the power is in the client's hands. The client is hiring the therapist to do a job for them. And that needs to be the premise of it, is that the client is not coming in. It's not like, oh, but my therapist makes me whatever. What does that even mean? Right? And we're going to go into that in some of the questions. So I just want to put that as a
I love that analogy. I'm going to be saying it over all the time because exactly.
It Baruch Hashem crystallized it for a lot of people. The other piece that I do want to say, and I feel the need to say this, I work with a lot of therapists. My role in this slide, just to say, is that I've interviewed about 140 therapists in about 2.5 years, and I do a tremendous amount of referrals. There are a lot of excellent clinicians. Typically on this live, we're not going to get, I love my therapist and I just want to share with the world that I love my therapist. Okay. So if anyone is considering the therapy experience and hearing some of the stuff that's going to be brought up, of course therapists can have their flaws. And of course there can be problems within therapy.
Right.
There are double that amount of people who are having a very positive, wholesome, therapeutic, good relationship going on. Those are not meant for this live.
So I actually always say that to people about schools. Like, you hear about all the schools, don't whatever, and I always say, you realize that mostly what I hear about are the problems. I don't hear the good stuff usually, right? I hear the problems, right? And that's what's going to happen in this live. We're going to talk about the times that therapy didn't work so that we can understand how to make it work. Right. But that's what we're going to do.
Okay, so let's jump right into someone who's saying before they go to therapy. Let's just talk about a couple questions of like prior to entering therapy, okay? This person says, sorry, one second. I didn't believe in therapy at all until I listened to some of your lives, Dr. K. So now you know why you're on Instagram. What if I feel happy and content, but people around me tell me I should be in therapy, but I have my doubts? Is like my doubts about therapy in general. Go.
Okay, so I have two answers to that question. First of all, not everybody needs to be in therapy. I think it's very fashionable. Somebody else asked this question. By the way, what I did was I sent Rivkah the questions that came into my DM. She had questions that came in without necessarily the names of people. I just cut and pasted into a Google Doc, and we're looking at the questions. So some of them came into me, some of them came into Rivkah. A different question came in just recently, do you think everybody should be in therapy? Right? Is like everybody seems to say, oh, go to therapy, do therapy. I think that not everybody needs to be in therapy, and not every problem is a problem that therapy, can solve. It's not like, oh yeah, I go to therapy. First of all, I do believe everybody could benefit from therapy. I think if I could, I would fund the world to be in therapy. Everybody should do it. It's fabulous. It's always good to know yourself and understand yourself better. But is it always necessary, right? In other words, is the expense always justified? Not always. Now, when you say that everyone is saying, obviously I don't know you, but if you're saying that everyone's saying I should be in therapy, does that mean that you're getting feedback from people around you about things that you're doing that they really think you wouldn't do, or you would do better if you'd be in therapy, and they care about you, and they're like, I went through that too, and actually therapy really helped me? I think the analogy that I love is there was a cartoon in the New Yorker years ago where there was a man standing outside of a fishbowl, and he was looking at the fish, and two fish were swimming in the bowl, and the man says to the fish, hey guys, how's the water? And one fish turns to the other fish and says, what in the world is water? Right? The fish is swimming in the bowl. To the fish, water is the world, right? In other words, we cope with things, we do things in a certain way, and we think that's the world. That's how it's always going to be, and that's life, right? And sometimes someone points out to you, no, you're actually swimming in water. Actually, you're making assumptions about the world, and those things could change. There are better ways to do things. Oh, I have been through it, and I know that there are better ways to do things. And I know myself, the first time I had to do therapy was when I was in graduate school. We were part of a certain, we were in a certain thing, and the idea was I think 5th year we had to be in therapy. This was 3rd year. And I was annoyed because I felt like it's 3rd year. When I signed up for the program, I was told I have to start therapy in 5th year. And straightforward, I was traveling into NYU, therapy is expensive, and they only let us use certain people on their list, which were, and they were subsidizing it, that was fine, but still, I had to come into Manhattan another time, and I just didn't want to do it, right? And what ended up happening was, I went into therapy because I had to. I'm a good student that way. I went into therapy. It was the best thing ever. But I remember specifically the therapist that I had, Dr. Goal in those years. I remember that when I saw her, there was something that I was doing that she pointed out to me was a result of my own psychological stuff. And it didn't have to be that way. And I just remember the click of oh, there's another way to think about that? And it was oh. And yeah, I was all about therapy. I was learning how to be a therapist. But that experience of what it's like to be in therapy and have your therapist point something out to you that's blindingly obvious, and that there's another way to do it. I was out of jail, and that minute I became such a convert to adults being in therapy because I was a child therapist, right? So I understood the utility of child therapy. You're 8, you get mad easily, we're going to teach you not to do that, right? You have OCD, we're going to teach you to touch the potentially germy thing. I got that. But to get the utility of an adult being in therapy, I wasn't quite there. And also I was oh my gosh. And just my whole life seemed different. I just remember that feeling of oh, I'm swimming in water. That was okay. So if you have people in your life that are saying to you, there's there's a therapy for that. This could be so much, but not that you're not wonderful. No, this could be so much better. Take them very, very seriously. right? Just like give it a try. Why not? Worst comes to worst, it won't work. That's the worst thing that could happen.
Right. Beautiful. Beautiful. Okay, next question before somebody goes to therapy. Does your therapist have to be your type religiously? Can it be damaging if she is not? Now, I want to say something before you answer that one. I want to just say one thing. I have a policy at Lynx that was set by our board that has nothing to do with anything else. And that is that within our Lynx girls, or Shlomi's Club boys, which is usually the children and teenage group, we have a policy of only referring to from therapists. Okay, that's just as a board. So I need to just like make that disclaimer. Having said that, I will tell you that in other events, or sometimes when it's not referred by us, right, I have conferred and worked with both secular therapists and non-Jewish therapists.
Right.
And I just want to say one thing to cultural competency, which I'm sure you'll touch on too, but I'll just say one thing. Probably anybody who is a good therapist, who has a good idea of cultural competency, will be able to do a good job. What I have interestingly is that when I visit communities where there's not much of a frum community, and even if there's a frum therapist, if there are 60 frum families living there and you're the one frum therapist, you might not want to see the neighbor.
Your aunt or your first cousin, right?
Right, exactly. And so what I ended up doing was I did actually a meeting with one of those therapists who was in the secular community. And what I found fascinating was that the girl was actually pulling the wool over her eyes, that in all frum households, this is the way parents are. And it wasn't things that were abusive or anything like that. And she just bought it as, okay, I guess in this culture, this is how people talk. I've never heard about it, but this girl was totally pulling the wool over her eyes. And I said, absolutely not. So when you talk about cultural competency, because the world is an ever-evolving, changing place, I will say that is something that if you are working, and sometimes there are a lot of benefits to it, but if you are working with someone who's not within your community, try to make sure that they have an awareness of how the nuanced functions of the community are to the best of their ability. So I'm just putting that out. Go.
Right. So in terms of that, first of all, I just want to remind people we're not taking questions or comments. Great comments are coming in. We're not taking them simply because we're going to get all over the place. So DM me if you want to continue the conversation. We are going to do this again next week. We have a lot more to say. The question was, how important is basically the cultural match or the religious match, right? If we're talking about religious people. I have 1 or 2 people on Facebook right now who are not Orthodox Jews, but either way, cultural match, right? If you're like an Italian girl from South Jersey, how important is it that your therapist understands what an Italian girl from South Jersey culture is like, right? So here's the thing. It depends on the stakes. It depends what we're trying to do in therapy. If the stakes are very, very high, meaning someone's extremely suicidal, severe eating disorder, something along those lines, clinical competence trumps cultural match, right? So if I think that someone might die, I care about the best therapist for that person. I don't care about anything else other than best therapist for that person. Happens to be that with that level of expertise, I have never found someone who's at that level of expertise who's not open to a cultural consult. I do cultural consults for people who are tops in their field. And sometimes it's like, I'm giving this person advice, like I read his books, you know what I mean? But you know what? He doesn't know like Lakewood, New Jersey, like yeshivish culture, right? So I'm just going to clue him into that. I'm not telling him anything about OCD because I have nothing to tell this guy about OCD. He has a lot to tell me about OCD, but I can clue him in to like what Lakewood, New Jersey 12th graders think, right? That's the job of cultural competency. When someone's that top, they're going to be very open to it. If someone's not open to it, I wonder about their expertise. When I do, by the way, cross-cultural work all the time in the sense that if I see a Hasidic girl from Borough Park, I want a cultural consult. That's not my culture. Even though I grew up as a somewhat Heimish girl in Borough Park, I didn't grow up as like a Satmar girl in Williamsburg. It's a different culture. I didn't grow up in Crown Heights. It's a different culture. I'm going to ask for a cultural consult because I get the larger picture. I can like imagine what it's like to grow up as like a Lubavitch girl in Crown Heights, but there are nuances of that culture that I might not know. So I'm going to call a Lubavitch therapist and say to her, like, clue me in, like base Rivkah 10th grade, what's it like, right? Because that's a cultural consult. I don't know it. I know some of it. I understand like, milchiks and fleischiks and things like that, but I don't know everything I need to know to work with that culture. Same thing. Recently, I was seeing a patient from a very modern Orthodox upscale community, and I called a friend of mine who lives in that community. I was like, all right, Give me the lowdown, like especially the college pressure and stuff like that. I wasn't up enough on it. I needed the cultural consult because I don't know this culture that well. When we're talking about personal development, and we're talking about particularly teenagers in therapy, there is something called transference and countertransference, right? Idealizing your therapist, thinking your therapist is amazing, and like you want to be just like her when you grow up. Very normal, right? I want to be just like my therapist when I grow up. Very normal. It's a very normal, like, situation to go through. I would be anxious about having a teenager idealize somebody who's completely outside of the way I want her to grow up, who's living a different lifestyle. I'd be cautious about that. Like I said, in situation of emergency or like very serious pathology, serious pathology, staying alive trumps everything else. But in a situation of like personal development, something very religiously meaningful like trauma or loss, I want the therapist to have somewhat of the same value system as the patient, because that's important. All therapy is a cross-cultural, interaction. I have to understand the culture inside your brain. You have to understand the culture inside my brain. It's always cross-cultural. But with teenagers in particular who are very into like that transference reaction with their therapist, I am cautious about those things. As an adult, I have seen it work out well, and I have seen it work out very not well. And like you said about pulling the wool over people's eyes, when you get older, you really are convinced water is the world, right? And your therapist might not know enough to call you on that, right? If she doesn't know to do a cultural consult, she doesn't even know to ask. Even if she did a cultural consult, she might not know to ask certain questions about certain things. I'll
give you a perfect example, Dr. K, that you're going to laugh.
Yeah.
I had this a couple of weeks ago, and anybody who lives in Borough Park and Williamsburg, laugh along with this question. A therapist said to me, she goes, I really don't get it. I said to the client that her mom asking her to go to her first cousin's wedding is absurd. And she said, and the client, because the way it came out is that the client was having a panic attack about going to this cousin's wedding, but telling her mother, I'm not going to my first cousin's wedding, was not even an option. Okay.
Right.
And this therapist she didn't say it. She was better than that. But she called me and she said, this makes no sense to me. Right. Like, you just about have to make it to your siblings' weddings if your life works out for you. Right. But you do not go to first cousins' weddings if they make you anxious, like ditch. And this was in a community, which is like a tight-knit Hamisha community. And she goes, my mother will kill me if I don't show up. So talk about those nuances, right? When you have another therapist who can empathize with the fact of like, there is that social pressure. What are the ramifications if you're not going to go? What is it going to be like for your family if you don't show up? What is it going to be like for your kids to hear that their mother didn't go to their first cousin's wedding, right? Right. And these are pieces that people don't consider.
Right. Also, like, I know I do peer supervision. My peer supervision group is with other psychologists. I'm the only Orthodox Jewish person in that group. There are other people who are Jewish who know something about Jewish practice, maybe traditional, but I'm the only Orthodox Jew. There are people who are not Jewish, right? And there are sometimes people make assumptions about Orthodox marriage or Orthodox communities that then their patient, they might feed into something where it's really a cognitive distortion what their patient is saying. I can't tell my husband that. I once had that. I was really funny. I really called someone on her bias. Someone asked me and she said, would your husband let you come? And I said, I'm just curious about your choice of words. My husband let me come. So she said, well, I said, you mean would my husband be okay with me coming? I said, I find it interesting to use the word let. And then we had this conversation about her assumptions about Orthodox Jewish marriage. And I was like, sweetheart, I have a PhD from NYU and a black belt. No one lets me do things. I do what I do. Like, you have to understand this culture. So if her patient is saying, oh, I could never say something like that to my husband, she might think, oh yeah, Orthodox men, they're so like tough on their wives. They're so strict. They're so, controlling. She might not call her on it and say, wait a minute, you can't, or you're scared to, or you don't want to, right? Because in her mind, Orthodox men are from whatever movie she watched about Orthodox marriage, which of course is totally accurate because Hollywood's great at like depicting our community fabulously well, right? So like, let's examine your assumptions here, about this community, because how are you going to be helpful to your patient? And this is somebody who would do a cultural consult, but she just had that assumption. And just that word choice of let, I wanted to make the point. So I just kind of like harped on it for a second. Like, I wasn't like, I'm not offended. We're good friends. It's fine. But like, I was like, I just want to point something out to you. The word let has a lot of assumptions in it, right? Would I ask my husband before I went away to a conference or something? Of course, obviously, we're married. We're going to have a conversation. Like, for one thing, who's picking up the baby from the babysitter, right? But, like, right, that's just like a normal thing. But the word let gave me insight into the assumption she was making, and she does have Orthodox patients, right? So does your therapist have to be religiously matched to you? I think it might be a good idea if you want very heavy, deep, nuanced work. But is it always a hard and fast rule? No. There are times when it's definitely more important to go to the best therapist for the job. Definitely. And then there are some people who are practically honorary Orthodox Jews at this point. But whatever, that's a separate conversation.
And that can get very complicated. Okay, so we want to go to one last question in this category, and then I'm going to move to another one, which is, there are two questions that are quite similar, and a few came in like this, right? I called Relief for a referral. They gave me 3 names. They claim all 3 are equally good in this situation. How do I decide which of the 3 names? Like, do I just pick them out of a hat? Right. And yet another person asked, she says, in general, how do I find a therapist? Great question.
Right. Any more like that, or those two?
Those were the 2. I think there were other ones of, like, I have a hard time finding a therapist, like very much along the lines of tough to find. I will be honest, by the way, because I interview so many therapists, I know how hard it is to find, because there are a lot of therapists, and I want to take a second to say this. People say to me all the time, and I know I wrote this in my stories, I'm like, is this person a good therapist? And the answer I always give is, well, is that doctor a good doctor? It depends. Are you looking for an endocrinologist? Are you looking for a gastro? Are you looking for an internist? Right? There are some therapists who are fabulous in dealing with anxiety or OCD. And there are other therapists who are great with trauma. And there are other therapists who are great with marriage, and some who are great with children. And people have different expertise. And by the way, one of the first red flags I have in interviewing a therapist, and Dr. K, you'll tell me if you agree with this, is one of my trick questions to a therapist when I interview them is, so tell me, what are the, if you had a magic wand and you could pick your favorite kind of clinical issue that you love to deal with, what would that be? And then the follow-up to that is, what are the things you tend to avoid in your practice? You're like, that's not for me. If a therapist answers that one by saying, there's nothing I avoid, I do it all, generally a red flag for me. So asking me, is this person a good therapist? If I tell you that it's not good for your situation, that does not mean this person's not a good clinician. They may be a phenomenal clinician, not for what you're dealing with, right? Like, I love Dr. Koslowitz. You don't do geriatrics. If somebody asks me for
I also don't do
substance
abuse eating disorders, right? There are things, you have to know what your limits of your competence are. And, I'd rather get better at the things I do than learn something new, a new field, a new area of expertise that I don't do. Like eating disorders in particular, I feel like you have to put a tremendous amount of time and effort and energy into really comprehending that world. So it's just not where I'm going to put my time and effort and energy. So I'm just not going to do that, right? I'd rather get even better at OCD. Like if I have a choice between, like now I'm going to, I had a few different conferences I could have attended. I'm going to be attending a conference late March. I had like 5 different things. There's one on complex trauma, like a 5-day course, an intensive course, and there's one on something that I've never done before. I'm probably going to do the complex trauma one because I want to get even better at it, and I've read this person's book and I really like it, so I want to like continue my training there rather than like learn eating disorders. It's new. It's not something I'm going to stick my head into at this point. I might I tend to treat patients, not conditions, so I might treat disordered eating within an adolescent, but I'm not, someone's coming in for eating disorder, I'm not your therapist. Someone wants couples therapy, I am definitely not your therapist. I know people who are your therapists, but they are not me, right? And you have to know that. I think a therapist who doesn't know that shouldn't has a problem, needs to be in some therapy and some supervision. Like needs
So
needs
going
some
back to the question, just how do you find a therapist? Like we don't typically open the book. So there are a few good referral streams within the community. Definitely use them, at least as a starting point, because they've done some vetting and they will know some red flags about some therapists. By the way, they only know as much as the feedback you give them. So if you've gotten a referral from Amudim or from Relief or from us at Links, go back and say, it's working, it's not working, this was hard about it, you should know this. Because I will tell you that there were times that I spoke to people at Relief who said to me, you know what, it took us one person calling us back and saying, did you know that she moved offices and now this is how the office
Right.
is. And
They don't know that. You should know Relief does not always know that kind of stuff. Their database is very big, and just because they don't refer someone doesn't mean that person's not good. It's just the first 3 names that pop up on their database that treat that condition. So someone could be great, and like I know recently I referred someone, and she said, I called Relief, I got these 3 names. How come they didn't say that name? Like, she was a little suspicious. I said, it just didn't pop up. Let's say I want a 9-year-old anxiety. The first 3 names that pop up, I'm making up people like Malki, Khani, and Suri were the first 3 people that popped up, right? And I was suggesting Hindi. You know what? Hindi was the 4th person. Her name just didn't pop up on their screen. That's how Relief does it. It's not like they're going to vet 300
3 names as someone who's kind of observed it a little bit. I will say this piece. It's not the first 3 names. It's that there are certain pools, and also that every person within the referral base at a place like Relief or in other places knows certain therapists that they build relationships with and definitely gets a sense. And obviously the more feedback you're going to give, the more you're going to have. So that is a very good start.
But also, by the way, another thing is also sometimes Relief might not refer someone because they know she's full. But let's say I know this person, I know that she'll take a referral from me. So Relief didn't say her name, not because she's not good, because people get suspicious about that. Not because she's not good, because they know she's full, so they didn't say her name. I happen to know that she'll take a referral from me, so I know that she'll take this case. And I know she really likes 9-year-olds with OCD. So I know she'll take it. So, so don't get so suspicious about things like that. But you can always triangulate a recommendation. You can talk, if you have a good relationship with a child, right? You can talk to your child's school. Sometimes medical professionals, like your general practitioner, your doctor, right? Sometimes your kid's pediatrician, they have information. Sometimes not. Sometimes they're like, we don't get involved in that. But sometimes you can triangulate. Have you ever heard this name? I heard this name. Call the principal of the school. Have you heard this name? Oh yeah, we've worked with her in the past. She's good. Or we haven't had great experience with her. It's helpful. You can always triangulate a little bit, and you can always call the person, look at their website, get a feel for them, try to get to know them. One of the reasons why I do Instagram and I do LinkedIn is because it's easy for people to get a feel for me. You're going to be able to know right away. I had someone come in recently. It was very interesting. It was brilliant what she did. I was so impressed. She came in and she said, I see that you tend to be a little irreverent. I wasn't quite the language she used, but you tend to be irreverent and you're very plain spoken. I need you to be super gentle with me. Can you do that? And I said, thank you for telling me. Now that I know, yes, I will make sure. I'm literally on top of when people come to my office, I have to log them into my electronic health system. I have her name and then it says be gentle in giant all caps, just to remind me that we're being gentle. You know what I mean? Only because that fact that she has a sense of me helped, right? It helped her know, right? That being said, there's certain stuff that I will not put on social media because of professionalism, but we'll get into that later. So that's really how you find a therapist.
Let's go into the social media piece for a second, because that's a perfect segue.
Right.
And there were basically 2 questions that came in about social media. One is how do you feel about therapists following their clients or following or commenting on their page or even just commenting to the client, even if you don't follow them, of like, oh, wow, I saw you just planned a party, if you're a party planner or something like that. And how do you feel about your clients following you on social media?
So interestingly enough, this is a cultural question. I'll tell you why. I sit on the state ethics committee for the New Jersey Psychological Association, and we did a ethics training, and it was with early career psychologists, which technically I'm an early career psychologist. I'm not sure why, because I've been doing this since 2002, but whatever. So we had this meeting, we had this training, and we were doing this thing, and someone said, would you Google a patient? Mm-hmm. And everyone in the room who was over 35 was horrified at the question. I would never. And everyone under 35 said, yes, of course, obviously, I would Google a patient. That's culture, right? So just so everybody watching understands that, if you're a millennial, right, you have different assumptions about psychotherapy and social media and Googling things and putting things on social media than people my age. I'm 43. So people my age are going to have a slightly different take on that. In terms of social media, remember we said about the fiduciary relationship and confidentiality. I think what we also have to know is some of our policies about confidentiality and about therapeutic relationship are holdovers from the Freudian days where the therapist was meant to be a blank screen, right? Which is old school Freudian psychodynamic psychotherapy, really psychoanalytic psychotherapy, where the therapist doesn't give anything. Everything's supposed to come from the patient. most of us, I am not a psychoanalyst. I am trained dynamically. NYU is very into, there's a postdoc in psychoanalysis, a lot of professors are psychoanalytic. I have undergone psychoanalysis. I am trained to do psychoanalysis. Not the way I work. I'm much more integrative. I'm more psychodynamically informed, and then I tend to do CBT, but I think psychodynamically. I do believe in self-disclosure to a point. In other words, I don't have a problem saying to a patient, you know, putting out there the fact that I know what it feels like to have a panic attack. I have no problem doing that, but therapy is not about me and my panic attack. Therapy is about you and your panic attack, right? But yeah, do I know what that feels like? Absolutely. I am comfortable with that because I do come from that CBT world where we are okay with some self-disclosure, right? Instagram, social media, all that stuff, there's a lot of self-disclosure, right? So old school psychoanalysis would be like, don't self-disclose. You can't put it out there on Instagram. That being said, because my patients have to come into therapy, and therapy is not about me, it's about them, you will never see on any of my social media a picture of my children. You will never see a picture of my menu or a party I went to or anything like that. My social media is all about professionalism. I might have a vignette about a kid of one of my kids. I might write something, especially on my LinkedIn, about like a conversation I had with one of my children and what it made me think about, something like that. Because like I said, I'm comfortable with a certain level of self-disclosure, but I'm not going to put my kids, my family, my social life out there. I don't like being tagged if I'm like in a social situation. I ask people not to tag me because even if I'm in a picture, let's say I'm at a wedding and someone takes a picture and they're posting it on their Facebook or whatever, for whatever reason, don't tag me. If I'm tagged, if someone noticed I was there, we'll talk about it. But I'm not putting that stuff out there because therapy is about the patient. That being said, do I expect my patients not to follow my Instagram? I expect my patients to do whatever makes them feel comfortable. If they want to follow my Instagram, they're going to follow it. I will not follow my patient's Instagram. The reason I'm not going to follow my patient's Instagram is I want them to come in and tell me the things. Give me the information. Tell me what's going on. I don't want them to be like, you know, somehow editing their narrative on their Instagram because I'm going to be on it. I also don't want to have a social relationship with them. So if they want to follow me, they're welcome to. If they want to not follow me, they're welcome to. They can do whatever they want. I will not follow them. That being said, we said at the beginning, therapists are human. Here and there, I've had a situation where I did not know that I was following a patient because somebody calls herself, I don't know, I'm going to make up a name. Somebody calls herself Toy Store 123 on Instagram and I have no idea she's my patient or my patient's mother or whatever. I don't know, right? And if it's pointed out to me, I will unfollow her immediately, not because I hate her. I know that has meaning. I'm not very good at Instagram, but I know it has meaning when you unfollow someone. I would unfollow her. I would tell her, we'd have a conversation about it. I'm not going to follow you as long as I'm working with your daughter. On LinkedIn, if I'm working with somebody's child, usually I would not interact with a patient of mine on LinkedIn in any way. Like again, I would unfollow her, have her unfollow me. We're not going to have a LinkedIn relationship if she wants to be a patient of mine. If I'm treating somebody like 5-year-old, I'm going to say for the duration that I'm working with your child, I'm going to not interact with your content because in LinkedIn you can't control what shows up in your feed, right? So I'm not going to interact with your content, and I'm going to expect you not to interact with mine. If I have to, if I feel like it's not going to work, I'll block them. Not in a mean way, not because I hate them, but just because while I'm working with your kid, we should not have an extraneous relationship. Humans can't do what they call Chinese walls, right? Humans can't unknow. You can't put the genie back into the lamp, right? Humans can't unknow what they know. So if I know something that you didn't want me to know, or I don't want to ever have a situation. Another very important thing, going back to fiduciary relationships. If the patient is the patient, I say patient, I'm a psychologist, I'm not a social worker. I think in terms of that medical model of what are we fixing here. So the patient is the person sitting in front of me. I am the agent for their interest in a fiduciary relationship, meaning even if mommy is the payer, right, mommy is the one who pays the bills, 16-year-old Sarah who's sitting in front of me, that's the patient. I am acting in Sarah's best interest, not in mommy's best interest. Now, generally in 99% of the time, Sarah's best interest is mommy's best interest, right? Because mommy usually has her kid's best interest at heart. But sometimes in the short run, mommy's best interest and Sarah's best interest do not coincide. Let's say mommy relies on Sarah's help a lot and Sarah wants to go to seminary in Israel next year. Sarah's best interest is for me to help her individuate from her family and express her needs and wishes and emotions openly. Right now, mommy thinks her best interests are keeping her home so she can continue babysitting. you know what? I have to represent Sarah's best interest, even if it's mommy who's paying my bills, because that's what we contracted to do. And I am very clear with my patients. We fill out pages and pages and pages of like what we're doing with teenagers, especially. I have a whole separate intake disclosure form with teenagers, what my role is, what my role isn't, what I can tell your parents, what I won't tell your parents, what information you're entitled to keep confidential, what you aren't entitled to keep confidential. I'm like super, super, super clear because I want everyone to know. And you don't know how many times, and this is always sad, that I'll say all this to a parent and she'll sign a form. Like, I voluntarily agree that even though I'm allowed to, as the payer, request to see the psychotherapy notes, I will never request to do that, and here's how you signed. I have gone to court and like successfully stopped my notes from being subpoenaed in court cases because people signed that. How many parents will call me afterwards and say, like, okay, so what did my daughter say? We just signed 23 pages that said you're not going to do that, right? I really did mean what I said. I don't lie, especially not to kids, right? But that being said, like, we have to be crystal clear because people don't always have the same assumptions, right? They just don't know that that's an assumption that we make in psychotherapy. You're the payer, but yet you're not entitled to that information. Once you are 16, you are entitled, at least in the state of New Jersey, if you're in therapy with a psychologist, because that's what I know, you are entitled to, you can sign yourself into therapy. You are the owner, you are the agent of your own information. You own your confidentiality, which means I can't tell your parents anything. If you're 14 and you're in therapy, even if your parents are paying, if it is a matter having to do with reproduction, meaning you want to get an abortion or something like that, if it's a matter having to do with substance abuse, I cannot tell your parents. You own your information. I'm crystal clear with parents and kids about that. And sometimes that means that I have a hard time sleeping at night. Sometimes that means I call my lawyer, or I call my peer supervision group, or I call a supervisor that I'm paying, right, to find out what to do. Here and there, though, that law can be deceptive. I remember one situation, one story that I had that was really upsetting in a way. A girl told me something that she was planning on doing. Now, I am allowed, there are three exceptions to confidentiality, right? The Tarasov exceptions, right? If you're a danger to self, if you're a danger to others, right? And if you are aware of a crime, certain crimes being committed, right? So if you tell me that you're planning on killing yourself, I have to tell someone. It might not be your parents. It might be Hatzalah. It might be, it might be your aunt. It might be somebody else. But I have to tell someone. I have to do something with that information. I can't just be like, all right, see you next Tuesday. If you're like, I have a revolver and tonight I'm going home, I'm blowing out my brains. If you're female, that's probably not how you're killing yourself, but whatever. I have to do something about that, right? I'm purposely using strong language. Sometimes, though, a kid tells me something. If you're planning on killing someone else, I have to do something about that, right? That's where the Tarasov story was, where Barbara Tarasov was killed by a patient who was in a mental clinic in the university she was in. He was like, I'm going to kill her, and this is how, and this is when. Told his therapist couldn't do anything about it, the killer, and he went and shot Tarasov, who then her parents sued the state of California, I believe it was. The Regents of the University of California is the name of the case. So and that's where we found out that now the law is that we do, if there's a clearly identified threat. So a patient once told me that she was about 15 or 16 years old, did not have a permit, did not have a license, but she was planning on stealing her parents' car that night and going to a certain club in Toms River from Lakewood. And I said to her, I kind of wish you hadn't do that because I have to do something about that. So she's like, why? I'm not a danger to myself and others. I said, you are so a danger to yourself and others. You are a danger to anybody. You are not a licensed driver. You are a danger to anybody who is walking on the street if you are driving that car, particularly under the influence. I actually do have to tell someone. I have to do something about that. So in the future, and that's what I always tell patients that story. I say, in the future, you want to tell me something. You're not sure if I have to tell somebody. What you could do to get around it is tell me in a hypothetical thing, right? Say, like, if I was going to steal my parents' car tonight and I told you that, would you have to tell them? Right? Would you have to do something about that? Then I can't sleep at night because I'm going to know this information, but legally I can't do anything. My hands are tied, right? So, and kids tell me things like that all the time. If you know that I have a boyfriend, would you have to tell my high school? And I'll be like, no, you're not. Is your boyfriend planning on killing you? If he's not, it's not a danger to yourself. It's not a danger to others. I can't tell your parents, can't tell your high school. I for sure can't tell your high school, but I can't tell anybody because there's no clear and present danger to yourself or others. So yeah, you could tell me that. You can turn that hypothetical into a real and we can talk about it, right? That's my way because I like to be crystal clear. That being said, there might be a parent who doesn't want her kid in therapy with me because I really do follow the law. Like I care deeply about being trustworthy with kids.
So that's amazing.
So let's go on. Right. So going back to the whole Instagram and social media stuff, our laws came from a time when we didn't have social media. And even the newer laws are from like the 90s when social media wasn't what it is today, right? So we have not yet figured all of this kind of stuff out. What I will say is any advice you get from me or any other therapist on Instagram does not constitute psychotherapy. Please ask a mental health professional licensed in the jurisdiction that you live in, right? And that person is probably not me, right? Because if you ask me a general question on Instagram, it's for educational purposes. If you're like, what kind of therapy is best for OCD? I am not treating you. I'm just telling you that I like to do exposure and response prevention. That's it. It is not my recommendation. I am not your therapist. You have no presumption of confidentiality if you DM me on Instagram. If you comment on my story and everybody sees it, then you commented on my story, everybody saw it. That was your choice to violate your own confidentiality. You have to know that because people have assumptions of confidentiality. I have a travel bag that actually says, I am a therapist, I am not your therapist. Like, just so people should know. If you tell me something that I love it. It's great. It's almost as good as my emotional baggage bag, but I have a bag that just says emotional baggage. But you know, which was given to me by a patient who was like, "Here's my emotional baggage," like when she left therapy, which was very cute. You don't have a presumption of confidentiality with me unless it's fiduciary. If you didn't pay me, right? Which is why when people say, oh, therapists are so money hungry, it's not that we're money hungry. It's that you're very protected by a fiduciary relationship. Yes, we need to get paid. Yes, this is a job. It's a calling, but it's a job, right? So sure, we need to get paid. And if we get paid, we can do the self-care and do the therapy and do the supervision and get the insurance that we need to keep you safe, right? And yeah, we get paid because it's our job. But if it's not a fiduciary relationship, you do not have confidentiality rights. Recently, a parent reached out to me and she found out that her friend's daughter's therapy was being paid for by the school. And she wanted to know why isn't her daughter's therapy being paid for by the school? I said, you know, when the therapy is being paid for by the school, I am an agent of the school. The daughter is not the client. The school is the client, right? So she has no presumption of confidentiality. Now, for this kid, her therapy is totally a school-related issue, and she knows that, and her parents know that. If I pointed out to this mother, I said, if the school starts paying for your daughter's psychotherapy, the school becomes my client. That means that it's their confidentiality, not your daughter's and not yours. Is that what you really want? She's like, no. I was like, right, that's why. So there's a reason for that. It's not the school is like being nice to my friend and not being nice to me. There's a very good reason why your daughter's therapy is private therapy and this girl's therapy is school-based therapy that is being paid for by the school for that reason, right? It all goes back to that question with a fiduciary relationship. Who's the client, right? Whose interests are we acting on behalf of? So I'm still going to that whole Instagram thing because this is why it becomes very complicated. Right? Because nowadays we do Google people. Nowadays we do know about people on social media. Your therapist, I have a social media policy. Your therapist needs to know, you need to know what your therapist's social media policy is. You need to have a conversation with your therapist. Here and there, I will say I've made mistakes. Like I said, I recently had something where someone said to me, you know, you interact with my brother-in-law on LinkedIn. Like my brother-in-law sometimes comments on your stuff on LinkedIn, and that makes me uncomfortable. And I said to her, well, look, here's the thing. First of all, if your brother-in-law, I'm making up a name. If your brother-in-law is like Moshe Friedman, CPA in Lakewood, I would have no idea that he's your brother-in-law. You know how many Moshe Friedmans are CPAs in Lakewood? Like, it's not, I would never make that connection because how can I? 7,500 people follow me on LinkedIn. There is no way I know who all of them are. And that's not the function of that site, right? I can't know. If I ever interact with somebody on LinkedIn, it's a professional kind of thing. Thank you for telling me, but you have to know how LinkedIn works. She's like, oh, I didn't know. The way he talks about, being on LinkedIn with you, it makes it sound like he knows everything about you. I'm like, okay, that's how he feels, but he doesn't know everything about me, right? He knows what I put onto my LinkedIn, right? Which again, if you're a therapist, be smart about what you do and don't put on social media. That's why you won't find pictures of my kids. And that's why you won't find pictures of things that happen in my life. So that kind of thing, yeah. We're still figuring the social media thing out. I do think that if you feel uncomfortable that your therapist is following you on social media, have a conversation with your therapist about that. Find out why your therapist is following you. Like I said, your therapist might not know it's you, number one. Or if your therapist is following you, she might think that you want her to. Or you might be telling her certain things through your Instagram feed, really bad idea, or whatever. So have a conversation about it. Talk about it openly. And have a conversation about the pros, the cons, the risks, the rewards. Like I said, if you're my patient, I will not be following you on social media, but unless it's accidental. But if you are following me on social media, that's up to you. Follow me or don't follow me. I'm not going to engage with you, though, on social media. I will engage with you in the office. That's the smartest way to do things.
Fabulous. Okay, I think we have about probably 10 minutes left. Let's fly through some of the negative experiences, and like I said, many positive experiences. That's unfortunately not the conversation here, but I do want to run through some of the negatives because some of them are red flags and some of them hopefully we can give a different insight into, but we're going to be real fast about them. Also, please realize one thing: we only know the information that's given to us in the DM. Possibly if I had a conversation with your therapist, I would hear a very different version of the truth.
Right.
And if I had a conversation with the guard at the door, I'd probably hear a third version to the story. And the purpose of that is that we all can only tell a story from our perspective. And it's important to just bear that in mind when you hear something from your friend of like, oh my gosh, that therapist is horrible. My friend went to her and she was doing XYZ with her. Right, exactly. You weren't there. You have no idea. You don't know what the struggles are. And because of confidentiality, you can't even ask that therapist and you won't hear it. So that's just important out there. Question number 1. You have like 60 seconds per question, Dr. K. Therapists.
We're going to do this again next week for those of you who we don't get to. We're continuing.
Whoever missed the beginning, there were over 40 questions, and we are not getting to all of them, but we're trying to cover as many as we can. And whatever we don't get to this week, we're going to get to next week, hopefully. Okay. My therapist is seeing a friend of mine and then scheduled our appointments back to back. It really bothered me. I've never been back there. Go.
Okay. 2 things. First of all, therapists are people. They make mistakes. She might not know your friends. She might not remember. You might have mentioned it in passing. You might have just said, my friend Suri, and your therapist doesn't know your friend Suri is her client, Sarah Klein, or whatever, right? That could happen, right? Again, making up names, right? So number 1, your therapist cannot read your mind. We are, I always say to patients, I am a psychologist. I am not a psychic. I won't know unless you tell me. If you think it's obvious, it might not be. My friend Suri, my friend Suri, my friend Suri. I'm not necessarily, the penny's not always going to drop. Number 1. Number 2, sometimes it's the secretary who didn't realize, right, who scheduled it. Sometimes your friend rescheduled her appointment last minute. Whatever, those things, mistakes happen. What concerns me is the best part of therapy is when you go back to your therapist and you say, hey, you scheduled me back to back with my friend and I was furious. And you have a conversation about it. If you can't have a conversation with your therapist about everything, then that's not good therapy. You should feel comfortable saying to your therapist, like, why did you do that? You hurt me. And either she'll apologize. I hope if she's competent and healthy, she will take ownership, she will apologize, or she'll explain, right? And either way, and not in a defensive way, explain what she was thinking. Like, oh, my secretary made that appointment. I had no idea, or whatever, right? Now, that being said, the fact that you never went back tells me something as a psychologist about how you handle problematic situations or conflict in your life. You might want to go back now and say, you know what, let me give her another chance, because that's where real therapy is going to start. When you do that, that's the golden thing. Like, calling your therapist on her stuff is almost always like the way to go when it comes to therapy. There's more to say, but we're going to stop here.
Right.
Okay.
Amazing. Okay, next question. I have a fear of going to therapy because I went to a therapist who wound up sharing information with my school and got me suspended. It was such a breach of trust, and when I confronted her, she said I was 14 and that she had parental consent to speak to my principal, which of course made me lose trust in my parents too. I hear people have, by the way, this question was heartbreaking. I hear people have good experiences in therapy, but I feel so hurt and unsure. I am 17 now. Maybe I should just wait until I'm over 18.
First of all,
yeah.
Okay, I'm going to interject a couple of things. First of all, ouch, I want to apologize for therapists everywhere. She had parental consent to talk to your school. However, with a 14-year-old, she would have needed patient assent, meaning that she has to get your not permission, but acknowledgement that you're going to be calling the school. She does not have the right to call your school without informing you of it first. The fact that she did that.
At what age does that start, out of curiosity?
14, at age 14.
Really? Okay.
Yeah. So the fact is you were at that class, now maybe she forgot and you just turned 14 and like whatever. At 13, I personally do not talk to a patient's school ever, even if they're 5, without telling them. If I'm going to talk to your teacher, I'm going to tell you in advance. I'm going to say, so I'm going to talk to your teacher, even if it's clear you came into therapy because you're 9 years old, you have ADHD, and we're doing a behavior plan. So when I call your teacher, here's what I'm going to say. Tonight, I had someone in my office, a girl, a 6th grader, and her teacher, because I wanted to talk to her teacher, and she said, how do I know that you're only going to tell my teacher these things and not these things? I said, I have a great idea. Why don't you come? And we will have it set, instead of me doing it over the phone. Why don't you come into my office? And then the teacher, to her credit, came in. She was going to be on the phone, but at the end she came in. Let's have this meeting, and you'll hear everything I say to your teacher. Be here.
Wow.
There was not going to say anything behind your back that I wouldn't say in front of your face.
Amazing.
You know? Because trust, you have to be able to trust me, right? So first of all, ouch, okay? If you were over 14, she should have had your ass sent. Unless it was something so dangerous. Like, again, we don't know the whole story. If you were like a danger to yourself and others, different conversation, right? I'm just guessing not, but different conversation, right? If you are over 16, at least in the state of New Jersey, and at least with psychologists, but I'm pretty sure it's across the board in the state of New Jersey, you are the owner of your confidentiality over age 16. Your therapist may not, it is a felony, your therapist may not share your information with anybody at all. If your mother's the payer, she may share certain limited pieces of information that you showed up, that you stayed for the full session, that you are making progress, or that you are not making progress. Vizehu. There's like a couple of other little things, but it's along those lines. If the insurance company has a problem with the bill, obviously she's allowed to tell the parent. Like I said, we have 28 seconds left. Like I said, I personally make parents sign that they won't ask for the notes. Technically, legally, they're allowed to, but I make them voluntarily sign. If they won't sign, then there are other therapists in the world that are
more next week. There's about 30 questions we didn't get to.